Hello, this is Dr. Evan Osar with Fitness Education Seminars. We've been talking about the low back and low back pain. So I'm going to show you a couple of quick assessments just to show you what the low back looks like and things to assess for with some of the common exercises we show and do for low back. So the first thing I'm going to have Melissa do is back extension. We use this exercise a lot to strengthen the low back, but unfortunately this creates more compression and stress on the low back than it actually helps. So what I'm going to have Melissa do is just lift her chest off the table, just like she's doing a back extension. And if you look here, you can see the huge bulge of her erectors and just the deep hollowing that occurs as she lifts her chest up. This creates a huge compressive force into the low back. And we often talk about the increased lordosis. What this is doing is increasing the lordosis and compressing the spine at the same time. And we see a lot of activity even all the way up here into the erectors if we palpate the lumbar erectors. So again, not a great exercise for people that have low back pain or even people that don't have low back pain, because this may tend to lead to overcompression of the spine. Another common exercise is to lift the legs, either both together or one at a time. So let's lift both legs. So as we lift the legs, we can also see a huge erector component. Again, not very good lateral wall stabilization. I can easily push my hands in here. And the other thing that happens is bring your legs back down and then do it one more time. And you can see her hyper-kyphosis through her thoracic spine to try to create stabilization through her rectus abdominis, rather than using the transverse abdominis and the abdominal wall, the deep abdominal wall, to create the stabilization here. So she's trying to flex her spine to anchor her extension of her legs and her torso and relax. And then another common exercise we do with our clients is some kind of leg lift to get the glutes. But if you really watch our clients, lift your right leg, Melissa. You see how she drives that pelvis down. Again, huge erector tone, huge hollowing, increased lordosis here, back down, and the other side as well. And same thing, you see a huge shift and more shift on this side, so more instability. Again, nothing here stabilizing the rib cage to the pelvis. So again, we see the huge compressive loads and a huge tonicity all the way up into her thoracic spine when she just does a simple exercise, even from this position. Now think about if she goes into a quadruped and she starts doing exercises from this position, how much load is going through her spine. So again, this is a really quick, easy assessment to assess whether this person has good stabilization or is overutilizing their erectors for their stabilization. In the next video, we'll show you how to correct some of these patterns and how to improve low back pain in your clients and your patients. This is Dr. Evan Osar with Fitness Education Seminars. Have a great day.